I think it's an important question. Let's look at where we are. In just the last year, less than a year, we've spent over $700 billion bailing out failed financial institutions. We've partially nationalized a number of banks. We've fully nationalized AIG. We spent $200 billion nationalizing Fannie Mae and Freddie Mac. Spent a couple of $100 billion nationalizing the car companies. We put the taxpayers on the hook for $5 trillion in contingent liabilities by forcing taxpayers to guarantee assets on the balance sheets of Fannie Mae and Freddie Mac. We passed an over $800 billion so-called stimulus bill. Then they passed a budget that is $3.6 trillion. This year alone, the budget deficit is going to exceed $1.6 trillion. By way of context, last year a lot of folks were really upset when the budget deficit hit a record of $460 billion. Now it's $1.6 trillion. Next year will be about the same. The fact is, the Obama administration released new numbers. Over the next 10 years, the deficit, the sum total of all the annual deficits over those 10 years, is going to be $9 trillion. Now, just so that you know, that's more than all the deficits we ran in the first 233 years of our country's history, from George Washington and through last year. That's a staggering amount of debt. I will tell you, I don't believe it's economically sustainable. And that's before this health care bill. So on top of all that now, they want to spend $1 trillion. That's what the Congressional Budget Office, which is controlled by the Democrats, and they crunch the numbers. This bill is a little over $1 trillion over the next 10 years, and costs after that accelerate. They don't bend the curve on Medicare, on health care costs generally, according to the head of the CBO, Congressional Budget Office. In his testimony before Congress, when asked, he said, no, actually, the curve rises. The curve meaning a graph of future projected costs. It actually goes up. Now, the cost is over $1 trillion. Now, they pay for part of that with huge tax increases. There will be taxes on S corporations, small businesses. There will be taxes on individuals. There will be wage taxes on employers who can't provide health insurance for their workers. They'll be penalized with an 8%. Let me just reflect on that for a minute, because I think that is one of the truly worrisome things that's going on here. We have a tax code that provides an economic incentive to provide health care for their workers. And so most businesses do, and the only ones that don't are those that can't afford to. They operate on margins that are too tight. And what we're going to do at this time, in this economic environment, we're going to punish those firms with a new 8% tax on all their wages. Now, they wrote into the bill, you can't cut people's pay rates just because we're hitting you with the new 8% tax on their wages. So they won't do that. They'll lay workers off. And that's what's going to happen here. See, I just think this is the wrong direction. There are things we could be doing to lower costs. We could allow people to buy health insurance plans regulated by other states. Joe says he wants competition, but he doesn't support a measure which would allow us to open up the whole country so that Pennsylvania families get to decide. Do we want a health care plan regulated by Pennsylvania, which, by the way, forces me or any of us to pay for chiropractic care whether we want it or not? Or do we want a plan that's regulated by a state that might have fewer mandates, might have a lower cost? I think there are things we can do, things we need to do, but we don't need to spend $1 trillion of money we don't have and saddle our kids with debt that they can't afford.